Hi, thanks for joining me again. This is Dr. Riley. I just want to share with you another video on COVID-19 vaccines. And I want to use a slideshow that was done by Dr. Rebecca Ray from the Medical Associates of Port Perry, where she did a presentation on dispelling the myths and getting the facts relating to COVID-19. I've asked her permission to use her slides, and she has kindly consented to that. So what's the big deal about COVID? Just to remind us how severe this problem is. Presently, just going to update those numbers there. Globally, we've got 162 million infections with 3.36 million deaths. In Canada, we've got 1.3 million infections with about 24,000 deaths presently. So this is a serious pandemic we're dealing with, and we want to make sure we can protect ourselves as much as possible. The variants also are, of course, I think, really causing putting quite a spin on this whole COVID-19. And here we are into our third wave in Ontario and in another lockdown. The mutations actually making the virus more infectious, more contagious, and even more severe illness in patients. What are we doing and what can we do? Of course, in the lockdown, staying home, wearing a mask, physically distancing yourself, washing your hands. And now we've got something much more powerful in all of this vaccination, which is able to help us to turn the corner when it comes to COVID-19 and the pandemic. I didn't mention to you in the previous video about vaccinations, but here's an infographic from Health Canada on how vaccines and how well they work. And you can just look at those numbers. You can pause the video and look at these numbers here. It's showing like 87 and mostly 99% decrease in the infections of things like whooping cough, measles, mumps, rubella, diphtheria, and polio. And it's interesting that these are in the vaccines we give to our kids, our babies when they come into the clinic to see us as family doctors. What vaccines are available in Canada? Well, 4 vaccines. And the most popular ones, of course, would be the Pfizer and Moderna mRNA vaccines. And this is a slide to just remind us again of the efficacy of the vaccine. The Pfizer, 97% protection from hospitalization, 100% protection from severe disease, and from mild to moderate disease, 95%. Similar numbers for the Moderna and even the AstraZeneca. So the vaccines are quite effective. I mean, I didn't imagine that the vaccines would have been this effective at the height of COVID. So this is pretty amazing. So let's bust some myths here. First of all, we can't trust the COVID vaccines because they were rushed. So the fact actually is that although the COVID-19 vaccines were developed in record time, it is not because they were shortcuts in the process or, we ignored safety in the trials. The research behind the vaccines is vigorous. Tens of thousands of people were included in the clinical trials. And that is more than 6 times the usual number of people included in a typical vaccine trial. In my previous video, I talked about the Shingrix vaccine and compared it with a Pfizer vaccine trial. 14,000 in comparison to 43,000. So a huge difference there in terms of numbers. So they went through all the studies, phase 1, 2, 3 trials. Second myth is the vaccine will give you COVID. And I guess by now you probably know that, well, no, none of the vaccines contain live virus particles and you can't get the infection from the vaccine. Third myth is we don't know what's in the vaccine. It's something mysterious, something for the government to track you, something ominous, something in some other religious context which you don't want to get. But all the ingredients of the vaccines are published, okay, and that's what we need to go with, the evidence, not with hearsay. Myth number 4, the vaccines are not safe. The vaccines are safe because we've got excellent short-term safety data on all the vaccines. We know allergic reactions are rare. We know that, well, also you've got post-marketing surveillance phase 4 studies. And it is because of the phase 4 studies that we've actually pulled back in using the AstraZeneca as the first dose in Ontario. Because of that, I'm not going to talk too much about the AstraZeneca vaccine. So I'm going to skip over these slides here. Some may say, well, I already had COVID-19, so I don't need a vaccine. We're advising patients, even if you had COVID-19, you can have the vaccine up, 1 month after your infection. We don't know how long the natural immunity is going to last, so we recommend just getting the COVID vaccine. Myth number 8, the delay of the timing of the second dose will mean that the vaccine is not effective. Well, the dosage interval that is recommended is a minimum interval. The reason why it was delayed so that we can have more people vaccinated with the first dose, at least one dose. And what has been amazing is that even one dose of the vaccine promotes tremendous immunity and prevention for this disease, COVID-19. So the vaccine as many people as possible. NACI recommended extending the second dose for as long as 4 months so that we can have more people being protected. And I'm sure you will agree with that rationale. And there's a slide showing the efficacy of just one dose, like Pfizer, 92% efficacy, and Moderna also 92%. However, the delayed dosing is not for everyone, and you will have to discuss this with your family doctor. If you're a transplant recipient, you're immunosuppressed for whatever reason, you discuss with your family doctor, your specialist, and determine, okay, whether you should be doing the delayed dosing, and it probably won't be advised. Vaccines are not effective against the variants. Well, all of the vaccines are effective against the UK variant, and there's variable efficacy against the other variants. We don't know when other mutations are going to show up, what's going to happen. Let's deal with what we've got now, what we know now. Okay, and COVID-19 is that there is a variant or wild type. Be vaccinated and receive some protection against this disease. The vaccine will affect fertility. There's no evidence to that. And what about pregnancy? Well, pregnant women were not included in the studies as typical. But what we do know is that pregnant women are at higher risk of severe infections. If you're following the news, you would have heard, well, there were more and more pregnant women admitted to hospital with severe COVID infections. And the Society of Obstetrician and Gynecologists of Canada, SOGC, came out with a recommendation that pregnant women be vaccinated against COVID-19. If you had a vaccine, what can you expect? Well, typical side effects from a vaccine, if you get a tetanus shot, you can have a sore arm, or even a flu shot for the first time, fatigue, headache, muscle aches and pains, joint pain, fever, chills, swollen glands, and side effects can be worse after your second dose. Would you still need to wear a mask? That's the position as of this date, to continue to wear a mask and do all the physical distancing and so on. Who should take precautions with the vaccines? Well, if you've got a bleeding problem, if you're on blood thinners, you have a history of fainting, you've had a history of severe allergic reactions in the past, anaphylaxis to another vaccine, if you're immunocompromised, or there's been some reaction to the COVID-19 vaccine in the first dose, well, then you'll need to take precautions. You will have to speak to your physician or specialist. Who can't have the vaccines, but of course, if you're out of the age group in which it was studied and being recommended, if you had another vaccine within the previous 2 weeks, if you're acutely ill, if you have some sort of symptoms and they're unexplained, well, we wouldn't want you to get a vaccine. If you have a history of anaphylaxis to polyethylene glycol, we would say, no, don't get the vaccine. So I'd encourage as many people as possible to go ahead, be vaccinated against COVID-19, protect yourself and your loved ones. Okay? Thank you for looking.